Halloween is one of the most popular times of the year, both for kids and kids at heart. The amount of effort people put into costumes, decorations, and treats is really impressive. Some go all out. I'm Laryssa Patti, one of the emergency medicine physicians at Robert Wood Johnson Medical School, and I'm here today to share with you some tips on how to keep you and those you love safe this Halloween. Getting a costume together can be fun, but keep a few things in mind. Make sure the length is short enough that you don't trip on the end of it. Some materials can be flammable, so be careful around heat and open flames. Makeup is preferred over masks because masks can sometimes obstruct your vision. We don't recommend a fake weapon as a prop, but if your costume isn't complete without it, make sure that it doesn't have any sharp edges or could harm anyone else. If you're using a toy gun, make sure that it has an orange tip to clearly identify that it's not real. One of my favorite parts about Halloween is the trick-or-treaters that come to my door. When decorating, I try to keep the path to my door free of any branches or other obstructions and cover any exposed cords. When planning your route with your trick-or-treaters, stay to well-known and well-lit areas. Children under 12 should have a parent or an adult with them at all times, and if your child over 12 is going out on their own, make sure you know the route that they're planning. As a pedestrian, always be aware of your surroundings. Walk in a direction facing traffic so that oncoming cars can see you. Avoid crossing the street in the middle of the block, and don't run. I know from the emergency department what can happen when people venture out into the road with their attention on their phone. Looking at your screen while you're walking is not safe in general, but that problem is magnified on Halloween. Don't let something scary happen to you. Halloween is one of the busiest days for auto accidents, with high rates of both collisions and pedestrian-related incidents. Children are excited to be trick-or-treating and may move in unpredictable ways. More pedestrian accidents happen in the middle of the block than at crosswalks or corners. Alcohol-related injuries can exceed those on New Year's Eve, so be aware of impaired drivers on the road. So when driving, slow down, eliminate distractions, and be alert. I would much rather see you and your child in costume on my doorstep than in the emergency department with an injury. Enjoy your Halloween, but be safe.